Hey guys, this is Dr. Hub. Now we look at the gastric adenocarcinoma. So under this there are two types, that is the intestinal and the diffuse. Now let's look at the intestinal. So under intestinal, the male to female ratio, this will be about 2:1, and this intestinal type, it has a bulky mass. Bulky mass is present, and there is also it has presence of the glandular structures. So the glandular structures are seen. Next, it is increased. There is an increased signaling. So increased signaling is via the WNT pathway. So there is increased signaling via the WNT pathway. Then comes the precursor. There are some precursor lesions. So these precursor lesions, they are nothing but flat. Then there is dysplasia as well as presence of the adenomas. So in short, there is a male to female 2:1 bulky mass, glandular structures, increased signaling via the WNT pathway, and the precursor lesions are flat, the dysplasia and the adenomas. Next we move on to the diffuse type. So in terms of the diffuse type, there is equal frequency of the males to female. Only in the intestinal sides, the male had a 2:1 ratio. So the male is equal to the females, and then what we have, there is a diffusely infiltrative growth. There is diffuse infiltrative growth. Then comes the presence of the signet ring cells. This presence of the signet ring cells, and there is a loss of E-cadherin. There is loss of E-cadherin, and there is no identical precursor lesions. No identical precursor lesions. So there is equal frequency in males and females as diffuse infiltrate, and the signet rings which are present in diffuse. There is loss of E-cadherin, and there is no identified precursor lesions.